Obstructive sleep apnea. Let's talk about it because sleep is no joke. Now, the term sleep apnea is a broad term, and there are three main types. Firstly, there is obstructive sleep apnea. This is where the throat muscles relax too much during sleep and obstructs the flow of air into the lungs. Then there's central sleep apnea. This is where the brain does not send the proper signals to the muscles that are involved in breathing, and this leads to your sleep being disrupted. Thirdly, there's complex sleep apnea, also known as treatment emergent central sleep apnea. This is where someone who has obstructive sleep apnea who starts treatment but then develops central sleep apnea. Now, in this video, I am going to focus on obstructive sleep apnea. But note, there is an overlap of symptoms between obstructive sleep apnea and central sleep apnea. So, what are the symptoms of obstructive sleep apnea? Firstly, loud snoring that may be reported by a spouse or even seen on a video from a camera that has been set up to specifically record you while you are sleeping. Additionally, it may be noticed that you stop breathing on multiple occasions during sleep, and then you choke, gasp, or snort before resuming breathing. Some people also report that their mouths are dry when they awaken. There may also be morning headaches and excessive sleepiness or fatigue or irritability during the day. Difficulty staying asleep can also be a symptom. So now you may be asking, what are the causes of sleep apnea? So recall, in obstructive sleep apnea, the muscles at the back of the throat become overly relaxed during sleep. This results in the airway becoming too narrow. Because of this, the level of oxygen in the blood falls and the level of carbon dioxide rises. So the brain will detect this elevated level of carbon dioxide in the blood, and you will be briefly awakened so that you can start breathing again. This period of reawakening is very brief and you are unlikely to remember it. It is during this brief period of reawakening that the person may snort, choke, or gasp before they resume breathing properly again. Now, a person may reawaken between 5 to 30 times per hour, and because of this, it is unlikely that they will achieve deep restful sleep. Now, let's talk about the risk factors for obstructive sleep apnea. Obesity. Fatty tissue around your upper airway can hamper breathing. People with naturally thicker necks may also have narrower airways. Enlarged tonsils. These can also narrow the airway, especially in children. Men are 2 to 3 times more likely to develop sleep apnea. However, the risk for women increases if they have gone through menopause or if they become overweight. Older adults have a greater incidence of sleep apnea, possibly due to the muscles of the throat losing their strength and are now unable to hold the airway adequately open. Family history. Having a family history of obstructive sleep apnea may also increase your risk. Alcohol and sedatives taken at night can also increase your risk of sleep apnea as they lead to an over-relaxation of the throat muscles. Smoking. Smoking increases the amount of inflammation and fluid retention in the upper airway, and so increases the risk of obstructive sleep apnea. Nasal congestion or allergies. If you have nasal congestion due to allergies or an anatomical problem, you are also at an increased risk. Additionally, there are also medical conditions that can increase your risk. Medical conditions that can increase your risk are congestive heart failure, high blood pressure, also known as hypertension, type 2 diabetes, polycystic ovarian syndrome, having a previous stroke, and asthma. If you are trying to treat your sleep apnea, you also need to manage your medical conditions. So, what are the complications of obstructive sleep apnea? Or what can it lead to? Daytime fatigue. Without proper sleep, you will feel tired, sleepy, and irritable. You will find it difficult to even deal with the minor problems or inconveniences of the day. High blood pressure and heart disease. The drops in blood oxygenation that occur due to the narrowing of the airway increases blood pressure. Obstructive sleep apnea can also increase the possibility of recurrent heart attacks, irregular heart rhythms, and stroke. Note that an irregular heartbeat can lead to sudden death. The chances of developing type 2 diabetes also increases with obstructive sleep apnea. You are also more likely to suffer from complications if you underwent a surgery requiring general anesthesia. So, when you are undergoing a medical assessment prior to a surgery, be sure to be honest about all of your symptoms when asked. Liver issues are also more likely. The liver blood tests have a greater chance of being abnormal. Also, an ultrasound of the liver may also reveal non-alcoholic fatty liver disease. Also, your partner is also likely to be affected as they are likely to be sleep sleep deprived due to the loud snoring. This may lead to reduced intimacy as they may need to sleep in another room. This condition can also put a strain on the relationship. So now let's discuss the diagnosis of this condition. As with most medical conditions, you will need to describe the history and the quality of your symptoms. In this case, your husband or wife would also need to describe what he or she has been observing while you sleep if possible. Your husband or wife may relate to the doctor that he or she notices that you are snoring loudly or gasping or choking during sleep. Based on your symptoms, you may be referred to a sleep testing center, otherwise known as a sleep lab, or a home sleep test can be done. The home sleep test is simple compared to that done at a sleep lab, but can yield valuable information and help to arrive at a diagnosis. In a home sleep test, you wear a small device which records data such as pulse rate and blood oxygenation while you are asleep. The result of your sleep test will then determine the next course of action. So now let's talk about treatment. In terms of treatment, there's lifestyle changes, oral devices, and airway pressure devices, and finally surgery. Lifestyle changes only are recommended for mild cases of sleep apnea. These changes involve losing weight, quitting smoking, treating allergies, and changing your sleeping position. Now, in terms of sleeping position, some people can benefit from a wedge pillow, whilst others can use a side sleeping pillow. As you can see here, the side sleeping pillow keeps you on your side and prevents you from rolling onto your back. If lifestyle changes alone don't help, there are also oral devices that can help keep the throat open by bringing the jaw forward. With the airway pressure devices, you wear a mask while sleeping. The mask is connected to a pressure generating machine by a hose. The machine keeps the airway open with mild air pressure generation. There are a few variations to this, but that is the basic concept. Now, for the most part, surgery is recommended when all other measures have failed. Surgery is typically aimed at removing or shrinking tissue at the back of the throat to create a larger airway. Now, for those with certain jaw structure problems, surgery may actually be the first choice. I hope you enjoyed this brief overview on obstructive sleep apnea. If you want to book an appointment or get more information, you can call or WhatsApp 747-5297 or 308-3370. We are located at number 4 Chincuna Gardens, Chinchin Road in Cunupia.
You can tap the description below for all of our contact information.